Hi, my name is Mariah Gear, and with me here today is Chris Hasted, and we work at Maine Equal Justice. We understand that this is a difficult time for people. In order to help protect the health of as many Mainers as possible, decisions have been made to close schools and most businesses, and to ask people to stay home as much as possible. These were necessary decisions, but they have also hit many families hard financially. Many people can't work at all or are working less hours. And people are also trying to stock up on things like groceries and other things they need in order to be able to stay at home. But that is very hard when you're living on low income. The state has chosen to make some changes to what we often call the safety net, or those programs that exist to help people meet their basic needs. The purpose of these changes is to allow more people to be able to get help during this difficult time. In order to help people better understand these changes and to get questions answered, we're here today with Liz Ray. Liz is the Associate Director of Policy and Programs for the Office of Family Independence. Hi, Liz. Thank you so much for joining us and having this conversation. It's so important for people to be able to hear from DHHS directly about these changes.
Hi, thanks for having me.
Thank you. And Chris is going to start off with our questions.
Hi, Liz, and my thanks to you for joining us today. So we're going to start out by talking about the SNAP program, sometimes known as the Food Supplement Program or the Food Stamp Program. And we're going to talk about these programs one program at a time because we know that the rules are different among them, and we want to try to make sure that we give people the best information possible about how each program is affected. So here we go on SNAP or food stamps. So you are aware that some people have a time limit in the SNAP program. They can only get benefits for 3 months in a 36-month period unless they're working or in a training program. These are usually people between the ages of 18 and 49 who don't have children at home. Congress just passed a law lifting this 3-month time limit, and we'd like you to tell us what the department is planning to do about that. When will you lift this time limit, and how will people know?
Hi, thanks, Chris. Yes, so we were notified by our federal partners on March 20th of this change with the 3-month time limit for what are known as ABODs, able-bodied adults without dependents, on our food supplement benefit program. So this became effective within the month of March, and it's going to last through the month that the emergency period ends.
Okay, so people that, so it will impact this month of March, right? The people will not have a time limit during this month, so that if they were not able to work or go to a training program, they will not lose their benefits. Is that right?
That's correct, effective of March, yep.
Thank you. Okay. Next question still involves SNAP. We understand that in this same piece of legislation, Congress gave the states the opportunity to provide additional SNAP benefits up to the maximum for each family size so that they can have more food during this crisis. Can you tell us whether the state of Maine is applying for the money to be able to give people a boost in their SNAP benefit? And if so, when will that money come?
Thanks. So yes, Maine is going to move forward with those additional SNAP benefits, and we have notified our federal partners that we're going to take advantage of that. So it will start with the effective month of April. So we will issue April and May benefits. Families will receive up to the maximum benefit amount that they could be eligible for based on their household size in those months. So those benefits for April and May are going to be issued during the no later than the normal issuance periods of those 2 months.
Okay, that's great news. Thank you. The next question is, we understand that the department has proposed to, or has decided to postpone SNAP reviews and 6-month reports so that people don't have to be providing that information to the department. Can you tell us how this will work, what months it will apply to, and when you expect to begin doing this again?
Yep, so we have moved the review and 6-month report dates starting with March reviews and reports. so that our program participants and OFI staff have plenty of time to process any reviews that are received during this health crisis. So our goal is to allow for that extra processing time for everybody involved. But I do want to emphasize that we are still processing reviews that we have received and are still receiving. So people should still send those in if they have them. We're just not denying cases, and we're basically just allowing additional time for those processes to move through. So I just want to make sure we're clear that if people have changes to report, if they have reviews to send in or reports to send in, to still go ahead and do that.
Thank you for that clarification. And I just want to further clarify, is it true that you won't be taking people's benefits away if they don't file those forms in the next few months, in the next couple of months?
Yes, for the next 2 months, yes.
Including for anything in March?
Yes, March and April.
Okay. And are you going to terminate anyone for any reason in the SNAP program, cut people's benefits off for any reason in the next couple of months other than they're going over the income limit for the program, which is 185% of the poverty level?
Yeah, so that's a great question. And it is possible for someone's benefits to still close under the SNAP program. An example would be if somebody does report a change, like they're moving out of state. That's just one quick example that comes to mind. Our requirements from our federal partners around SNAP eligibility, there are some basic criteria that haven't changed, like I just mentioned, residency. So what we are doing is allowing for that additional processing time for 6-month reports, reviews, and taking advantage of any other temporary waivers that we're being offered by our federal partners for applications to be processed more quickly, and any other processes that we can postpone, we're doing that. Any other flexibilities that are being offered, we're going to take advantage of those. But there is still a possibility that a benefit could close for one of those broader general reasons. It won't be for failure to provide verification or failure to provide a review or report form.
Okay, thank you. So a number of people have asked us, I guess, now I'm going to switch to Maine Care. So we're going to make you a Maine Care expert for the next few minutes. Will people who have been receiving Maine Care be able to keep those benefits throughout this crisis, even if they have changes to their income or their household circumstances?
So this is different, as we mentioned at the beginning, that all programs do have different rules. So for the Maine Care program, we have this great flexibility during this emergency crisis to allow us to not close any Maine Care benefits throughout this time period. So if somebody does have a change outside of moving out of state or a voluntary closure, we will always keep the Maine Care open during these next few months.
And how long do you expect that protection for people to last, Liz? Do you know the month in which that will end?
It's the month at the end of the National Declaration of the Public Health Crisis. So basically the message for people who are keeping an eye on that is to keep an eye on our website information, which I'll share throughout this conversation, but also any information from the federal government as well on when the emergency period ends. I'm quoting emergency period.
Okay. Okay. We've also had questions from people that had a job in the past and they didn't qualify for Maine Care, but now they've lost that job and they want to apply now. Will the income from the job they just lost affect their eligibility for Maine Care in the next few months or until they get another job?
So the answer to that is no, it will not have an impact. So Maine Care eligibility continues to be based on current and prospective circumstances of applicants.
So whatever they earned in that job that they lost will not count against them for the purposes of becoming eligible or getting Maine Care benefits now.
Yes, now. Yep.
Great, thank you. And so one last Maine Care question. Most members of Maine's immigrant communities can't get Maine Care, but need health care right now, just like all the rest of us. What is the department doing to help them?
So the department continues to work closely with the federal government on how we can best assist the immigrant community. So we're still in the process of getting guidance and clarification from our Medicaid federal partners and looking at all the options that are available and allowable within the state. At the time of this recording, there's actually a conversation happening right now about this very topic involving state and federal partners. So this just kind of leads me to, again, state that checking our website, our maine.gov website, is a great resource to find out about these very fast changing processes and policies that the department is trying to take advantage of at this time of need. So this is one where I can't give you a definite answer right here, right now, but it could change as of tomorrow. So, you know, the department stays in close contact with Maine Equal Justice, and we also update our website very frequently. So we'll just have to stay in tight communication to share those changes as we learn more about what we're allowed to do.
Okay, thanks very much, Liz. And now I'm going to turn it over to Mariah to ask you some questions about TANF.
Great, thank you so much. So we're moving on to the TANF program. TANF stands for Temporary Assistance for Needy Families. And we understand that there's been a few changes to the program to allow people to take better advantage of that. So my first question is, if a family is on TANF and is going to reach their 60-month time limit during this emergency, what will happen to them and their TANF benefit?
So currently, TANF policy has extensions that are available for people to request, which would allow them to continue to receive benefits past their 60-month time limit. And the department is using one of those extension types that is considered an emergency. We're using that extension type as the opportunity to open people up or continue people's TANF benefits under that extension. However, they do need to request that. It's not an automatic process. We're not assuming everybody's in the same situation. So there is a request that's required for that. We haven't changed the process for that. So it is, people can verbally request the extension, or if their case is about to close, they will receive an extension application in the mail from us as well that they can use.
Okay, great. That's really helpful. Is there anything that's going to come with that extension application that will explain the current situation has extension qualifications?
There currently is not anything in writing that goes out in the mail.
Okay. Wonderful. Thank you so much. And then as far as people who've already used their 60 months and have been off TANF for some time, are they going to be able to use that same emergency to come back on TANF during this time?
Yeah, that's a great question. So yes, again, we're not changing our current processes for requesting an extension, but an individual, we would encourage those individuals to apply for TANF. At the time that they're applying, it would be the same situation. They can verbally ask for this extension, or they can complete an extension request form, which is a one-page form.
Wonderful.
We would follow that same process. So again, it's considered an emergency extension.
Okay, that's great. That's very helpful. Thank you. If someone, just a follow-up question, if someone is applying right now and they've been off, and they don't know to like specifically say, I need this emergency extension because of COVID, is the worker that they're talking to probably going to kind of help them understand what extensions there might be?
Yeah, so we have shared that information and consistent communication messaging out with all of our staff just recently. to encourage that conversation to occur. We have a dedicated group of eligibility workers around the state that do focus on TANF work specifically. And our TANF program manager has a weekly conversation with that team. So they are in really close contact and have shared that communication very recently.
Okay, thank you so much. We understand that people will not have to come in person and do a face-to-face interview during that time. Usually TANF requires a face-to-face interview, but we understand that that's being waived at this moment. Is that correct?
That's correct.
Okay, great. And what about people who are working with FedCap who normally would have to be going in person to the FedCap offices? What's going on with those people?
So it's also a situation where we are waiving any prior expectations that we had on face-to-face engagement. So currently, if somebody applies for TANF, they are required to attend an orientation meeting, and those are held at our FedCap centers. There's 16 of them around the state. FedCap is now doing those orientations by phone, much like our eligibility staff are doing with the TANF applications. And any other ongoing interaction that a participant would have with FedCap will either be done over the phone or they may be done using some other type of technology resource. And I also would like to just share that FedCap staff are following a lot of the same guidance that OFI, our department staff, are following. And their hours of operation are mimicking our open to the public hours of operation. So pretty much if anyone wants to know if they can drop something off if they want to, or if they do, following social distancing, proper protocol, if they for some reason do want to talk with their worker at FedCap, they do have those options just like they do coming into our OFI offices, following those same hours, and all that's listed on our Maine.gov website, because that's always subject to change also.
Okay, great, thank you. And one other follow-up question about FedCap. So, parents are managing a lot of things right now. Kids are home from school. They're trying to manage this crisis. They may be having things that FedCap is asking them to do for participation, and usually if they weren't able to do those things, they might be facing a sanction. It's my understanding that the department is not going to be sanctioning anyone during this emergency. Is that correct?
That is correct. We will not be imposing any sanctions on individuals during this time of emergency.
Wonderful, thank you. All right. And then actually, I do have one more TANF question. So it's actually a TANF SNAP question. So immigrants who are able to get TANF and SNAP through a state-funded program lose that eligibility when they start working. If they are losing their jobs during this time and no longer working, are they able to get back on those programs?
They are. So there's currently a policy within TANF and SNAP that it allows for what is called a hardship period, and it does apply to that scenario that you just discussed.
Excellent, wonderful, thank you. Moving on to general assistance very quickly. We've definitely been hearing from people who have not been able to get in touch with their town in order to apply for general assistance. It's my understanding the Department of Health and Human Services assists people when they aren't able to get their general assistance issue resolved. Is there a way that they can contact the department? Is the department helping with that right now?
Sure, and I'm glad that you brought it up. We encourage people to contact our general assistance hotline number, and it's 1-800-442-6003. We have a team of a couple of field examiners and a general assistance program manager who respond to calls from that hotline number. Our general assistance program manager is in really regular contact with the municipalities right now. And much like any of our other operations, they are looking at some alternative ways to connect with individuals and accept applications. So many of the municipalities are using drop boxes now at their facilities and then conducting application interviews over the phone. So they're following a lot of the same protocol that the department is.
Wonderful, thank you. I have to say, I have been super impressed by how quickly the department has managed to respond to this and change the way that they do things and process things in order to keep up with these changing times. It's really impressive, and people are working very hard. So I just want to say that we acknowledge that. We're aware that that's happening. Even though they're doing such a good job, there's still some delays, and people are having a hard time getting through on the phone. And certainly we always encourage people to contact the department themselves. And so at this time where people are having such a difficult time to get through, is it possible for it to be that they could leave a message and someone could get back to them?
So that's not possible at this time. I
Okay.
appreciate that it's a challenge, and we do expect with the current economic situation that our applications may increase, and the requests for assistance from us will definitely increase. But what we have been able to do in response to an increase in calls is we now have staff who, because of our changes in office procedures, aren't assigned to do intake work at the regional offices. So we have many more staff available to work those phone calls. And I want to go back to your comments, Mariah. Thank you very much for recognizing the fast-paced setup that the department has gone through to keep our eligibility workers working remotely.
Yep.
But they are still answering those phone calls. So, and as you know, there's other options to contact us, even though it's not call and leave a voicemail and we get back to you. There's other options, including email, fax. We're still using postal mail options. And then of course we have our online services on My Maine Connection.
Okay, great. I heard a rumor that the phone lines were starting to open at 7 now. Is that true?
I would have to confirm that.
Sorry, that wasn't on our prepared questions.
That's okay. I believe so. But you know, it just the broader message is we're always looking for ways that we can be flexible during this, time of challenge that everyone's facing.
Awesome. Thank you so much. So more and more people are looking to apply for unemployment as they're being furloughed or their jobs hours are being cut. We were wondering if you could talk to us about how unemployment benefits affect eligibility for other benefits, specifically people who were already on Maine Care and working, who lose their job and go on unemployment. What does that do to their Maine Care?
So currently, as we've mentioned earlier, we're not closing anyone's Maine Care coverage. So unemployment benefits right now coming in are not going to impact somebody's Maine Care.
Great, that's wonderful. And what can you tell me about once, so it looks like people are going to be getting an additional $600 of unemployment from the federal legislation. What can you tell me about what that's going to do?
So it's the same piece, is in play, that we're not closing Maine Care coverage right now, whether it's whatever the income change is. But we are still analyzing the federal act that is implementing that extra $600 of unemployment benefits. So again, we don't have a definite answer right now. That's one of the conversations happening at the time of this recording. So I will encourage people to check out our website, and we'll keep updating individuals and agencies, partners like you, on what information we do find out around the other pieces that are moving forward with that federal act.
Okay, and is that, I don't want you to have to answer the same question again, essentially, when we're talking about the $1,200 stimulus check that people may be getting, is that the same message?
It is, yeah.
Great, thank you so much. All right, so we're going to talk for a minute about paperwork that people need to turn in. It's getting really complicated for people to be able to track down things as they're sheltering in place and they don't have their own fax machine or printer or any of those things. Especially if someone's employer is closed down now and they need to provide a letter saying that they are not working there anymore. What steps is the department taking to verify income or other information by collecting from other sources?
Okay, so the department has a position where if an individual is trying to seek verification and is unable to do so, that we must assist them in doing that. So that hasn't changed. We do have several technology resources that we can use to do our own form of verification. One example is a system called the Work Number that a lot of employers are connected to, and we can access that. But again, we're continually looking at federal flexibilities on our programs and how else we can help people in that type of situation, including considering what's called self-attestation. So basically just, we're gonna take someone's word for it, but we also have to clearly note it in our case records.
Okay.
So we are still asking a lot of questions, but during this time period, we do have some flexibilities in place.
Wonderful. Thank you. That's really helpful. So a lot of people are needing to shelter in place and maybe have someone else do their grocery shopping because they're at higher risk or for some other reason. If a SNAP participant needs someone else to get their groceries for them, what does that look like? How do they do that?
So it's always been possible for a SNAP participant to have someone else do their grocery shopping for them. So that hasn't changed. Basically the individual who is doing the shopping for that SNAP household would just need to have the EBT card in hand as well as the PIN number that is associated with that EBT card.
Okay, thank you. Some people need help applying for benefits. Some people are having struggles with communicating with the department for whatever reason. Right now, it's hard to get to the department to approve this, what's called an authorized representative or a helper to help manage that, because both the individual and the authorized representative have to sign the same piece of paper, and getting that paper back and forth to people at the moment where people are isolating is difficult. Would it be possible for the department to consider accepting a person's oral statement that they need a specific person to help them without requiring these signatures?
So, this is a good example of a tough balance, right? So we want to be able to move forward with any flexibility that's possible so that we can help get services out and benefits out as quickly as possible. But it's also critical to the department to protect people's confidentiality and security, and the legal requirements that we have. We can't waive at this time. So the requirements around designated authorized representatives do still require that paperwork.
Okay, thank you. And the last question that we have down here is about zero income verification. So for some people who are applying for benefits, they currently have no income. And a lot of times the department wants to know how they're paying their bills if they have zero income. And that can be difficult to prove even under normal circumstances. Is the department able to accept the person's statement? So self-attestation, which you mentioned earlier, is that something that we're able to do for that particular issue right now?
Yes, so during this health crisis, the department has been approved to waive federal requirements for verifying when it comes to application determination and changes and redeterminations. So we have already implemented that self-attestation for this emergency time period, but I'm going to repeat something I said before, that we do still have to document really clearly in our case records. So people still will hear a lot of questions from our staff, and it's not because we're doubting the declaration or self-attestation. It's because of basically our record keeping, our reporting requirements that come from our federal partners.
Thank you. That's actually very appreciated clarification, because sometimes people do feel like when they're asked all those questions, like they're being doubted or they're being targeted. And it's really good for people to understand that that's just something you have to do. Thank you.
Mariah, can I jump in for a minute with a follow-up question to that?
Of course, yes.
And I really appreciate the time you've taken, Liz, to answer these questions as clearly as you can right now in an environment where everything's changing so quickly. Sorry. I tried to stop that phone from ringing. So on this self-attestation, does that apply to all the programs, TANF, SNAP, and Medicaid, that you folks are administering? And we'll go ahead and answer that one first.
Well, I was just going to say, I want to clarify that, and again, refer you back to the website, because you know, as we've mentioned before, every program is different, and in some programs, we have approval from our federal partners for self-attestation for example, just applications. So it's a little more detailed than me just saying self-attestation for everything all the time. So I don't want to give you a quick answer or any misinformation. So I'd rather follow up and get you some clarification.
Okay, we appreciate that. And for now, I think we could just suggest to people that if they're having difficulty getting verification, they should tell you so and ask if there's anything you can do to make that easier for them. Sounds like you're trying to do that. Okay, yeah. Thank you for that follow-up.
Yeah. It's really helpful. A lot of people feel like they need to have everything in place before they apply. And one of the things that I tell people all the time is just apply. Apply, and the department will help you figure out what you need to provide afterwards, but just apply because it gets that date in there.
That's 100% correct. Especially right now, even if you don't know exactly what your circumstances are going to be next week or the week after, apply now. It locks in that application date.
Exactly.
And gets the process rolling, and that's a safer bet to provide for families than waiting.
Exactly. Some people may be applying for unemployment and haven't gotten it yet, and they can apply for benefits too, even though they don't know what their unemployment might be yet, and then it might change next month, but at least they get in there, correct?
Absolutely, yes.
All right. Is there anything else that you want to message to people before we end this, Liz?
I don't think so. I appreciate the time that you guys have given us to share our information. Everything's moving quickly. Please continue to check our website. So Maine.gov, we have one piece of the Maine.gov website is specifically for our programs like TANF, SNAP, and Maine Care that we've been talking about. And that's Maine.gov, and it's a / I don't know how this will come out on the video, but DHHS and then OFI. And also on the Maine.gov website, there's a lot of information from CDC as well as other programs within the state that are having some changes based on the coronavirus. And so that one is Maine.gov /DHHS /coronavirus resources. So people can find some other information about other department programs.
Wonderful, thank you. I think it might be something we could do to make sure those links are included when we put this video out so that people can access them easily. I just want to close by thanking you, Liz, so very much. We really appreciate the time that you came today and put into answering these questions. And just encourage people who watch this to contact the Department of Health and Human Services if they have questions, to go on their website, to also contact us at Maine Equal Justice if they're having trouble and they're struggling to get through or they're struggling to get the programs that they need. We have a new website. It's mainequaljustice.org. And we also have a COVID site with updates as things are changing up on our website. And then you can call us at 626-7058, or you can contact us through our website. You can leave a message there and it gets to one of our direct service workers. So you'll either talk to me or to my coworker, Sue. So thank you again, everybody, for listening today. Contact us if you need help, and hope you have a great day. Stay well.
Thank you.